Welcome to our nursing assistant mock interview prep video. Whether you're just starting your journey or looking to refine your skills, we're here to help you succeed. Let's dive right into it and explore what keeps you motivated in this rewarding role. So, what keeps you motivated in your role as a nursing assistant? This question helps interviewers understand what drives you and how dedicated you are to your role. To nail this question, here are a few things to consider. Share your passion for helping others. Talk about meaningful interactions with patients that inspire you. Emphasize the significance of teamwork in keeping you motivated. Highlight the positive impact you have on patients' lives. Express your commitment to personal and professional development. Now, let's look at a solid example of how to respond.
I find great motivation in helping patients feel comfortable and cared for. For instance, when a patient smiles after I assist them, it reassures me that I'm making a difference. My motivation also comes from the rewarding relationships I build with patients. Each time I see a patient improve and know I contributed to their care, it inspires me to give my best every day.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for nursing assistant. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you tell us about a time when you worked as part of a healthcare team? What was your role? Interviewers ask this to assess your teamwork skills and how you interact with others in a healthcare setting. Here are some tips to effectively answer this question. Choose a specific situation where teamwork was crucial. Clearly define your role and contributions within the team. Explain how you communicated with team members. Describe the outcome and what you learned from the experience. Emphasize skills like collaboration and empathy. Here's an example to guide your answer.
In my previous role at the nursing home, I was part of a team caring for residents during a flu outbreak. My role was to assist nurses with vital signs and deliver medications. I communicated regularly with nurses about residents' conditions and helped ensure everyone was comfortable and safe. As a result, we maintained a high standard of care and minimized the outbreak's impact, reinforcing the importance of teamwork.
Describe a situation where you had a conflict with a colleague. How did you handle it? This question is designed to gauge your conflict resolution skills and how you work through disagreements professionally. Consider these points when crafting your response. Pick a real example that's not controversial. Focus on your feelings and actions during the conflict. Discuss how you communicated and listen to resolve the issue. Highlight the positive outcome and what you learned. Emphasize teamwork and understanding. Let's review a potential response.
In my last role, a colleague and I disagreed on how to handle a patient care scenario. I took a step back to discuss our differing perspectives openly. We ended up collaborating to find a solution that worked best for the patient. This experience taught me the importance of communication and teamwork.
Imagine you find a patient who is unresponsive. What actions would you take? This question tests your ability to handle emergency situations and your understanding of patient care protocols. Here's how you can approach your answer. First, check for responsiveness by gently shaking the patient and calling their name. If there's no response, assess their breathing and pulse. Call for immediate help or alert a nurse. If trained, initiate CPR or follow basic life support protocol. Document your findings and actions as soon as possible. Here's how you might structure your response.
First, I would check the patient for responsiveness by gently shaking them and calling their name. If there is no response, I would assess their breathing and pulse. Then I would call for help and start CPR if needed while waiting for assistance, and ensure that I document everything I did afterward.
If you were assigned to a busy floor and resources were stretched, how would you prioritize your tasks? Interviewers ask this to see how you manage your time and prioritize tasks in high-pressure situations. To effectively tackle this question, keep these tips in mind. Assess patient needs and urgency immediately. Focus on critical tasks like vital signs and medication administration. Delegate tasks when possible to other team members. Stay organized and create a simple prioritization list. Communicate effectively with team members about priorities. Here's an example to help illustrate your point.
I would first assess the patients to identify who needs immediate attention, prioritizing critical care. For instance, I would take vital signs for those who are unstable first before moving on to other tasks. By organizing and communicating effectively with my team, I ensure that all patients receive the attention they need, even during busy times.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.